The Duke Family Medicine Residency Program is located in Durham, North Carolina. We are in the Department of Community and Family Medicine, a department that is part of a large university health system. We are very proud to have a very strong family medicine residency program in a department whose core value is to take care of people in their communities and to find ways to improve health in the community, to look at innovative ways of addressing healthcare disparities and improving health in general. Our residents are passionate individuals. We have people here who are very interested in policy, in leadership, in community engagement. Our residents are people who bring in a lot of passion and a lot of interest in learning to be excellent clinicians. By providing an environment for learning where we really are meeting those needs, we create a very successful residency program. We have teams of both healthcare experts and members of the community that help to form these residents to be very well-rounded, excellent clinicians, experts, leaders who will then go on to work in different communities. We have an emphasis in population health, community engagement. We have an emphasis in research, in critical thinking, and really in meeting where is it that primary care needs, what kind of role does primary care physicians have to really meet the needs of a population.
Family medicine residence training is usually 3 years long. In our program, about the first 12 months is mostly inpatient training, and then the latter 24 months is ambulatory training. We have an outstanding relationship with many of the subspecialists here at Duke, where the residents receive a very good subspecialty training, in addition to the outstanding primary care training they get in the Family Medicine Center being taught by our family physicians, so they're very well-rounded and can take care of most clinical problems.
I chose family medicine because I strongly believe in community health, and family medicine is a logical choice because it gives me the training to do full spectrum care, from kids to adults to geriatrics. And also there's a strong emphasis on preventive health and wellness promotion. So that's why I picked family medicine and why I came to Duke Family Medicine.
Here at Duke Family Medicine, our residents are assigned a panel of patients that they will care for throughout their 3 years of residency. They follow their own patients here at the Duke Family Medicine Clinic, in the hospital, in the emergency room, at nursing homes, in the patient's private home, or at community sites. Our population of patients is ethnically diverse and represent a variety of socioeconomic sectors. 20% of our patients are elderly and are on Medicare. Another 20% are on Medicaid, our government insurance for the poor. And the remaining 60% have a form of private insurance. These patients range from our highly educated college professors, colleagues and students, to those who can barely read or write. We take care of patients of all ages, from babies to the elderly, and take care of our expectant mothers as well.
We prepare residents to work in primary care. We manage multiple comorbidities, preventive and acute and chronic care, as well as musculoskeletal, dermatologic, and gynecologic procedures. We train residents initially through simulated scenarios to promote dexterity and ability prior to doing these procedures on patients. Then they take these skills into the clinic where they are supervised by family doctors.
I chose Duke Family Medicine for a residency because of the outstanding faculty that we have here and the world-renowned facilities within which we work. We deal with a lot of very underserved patients here at our family medicine clinic, which really, as a resident, enriches our experience.
Outside of training great family physicians, our family medicine residency program is built upon 3 pillars: population health improvement, leadership development, and research methods and analytic thinking. Specifically, our population management rotation is built upon quality improvement, transitional care, care management, and group visits. We hope these specific skills will give our residents the ability to better take care of populations in the future.
Lo importante es demostrar a los médicos que tienen un papel significante en mejorar la salud de la comunidad. Ellos tienen conocimiento médico, conocimiento de los problemas de sus pacientes, legitimidad y vinculaciones con mucha gente. Ellos pueden colaborar con otros sectores de la comunidad para mejorar el sistema de la salud y para enfrentar los problemas de la pobreza y la falta de educación y la falta de acceso a recursos, los cuales afectan mucho a la salud comunitaria.
I chose the Duke Family Medicine Residency Training Program because it would give me the opportunity to understand taking care of individuals in the office setting, but as well as where they live. I want to take care of infants all the way to older adults. And this is particularly important in the Caribbean, where I was raised, where there is a great need. And so here at Duke Family Medicine, I hope to gain the skill set to do just that.
The Duke Medical Student Experience in Family Medicine is a requirement of all our Duke medical students. We were fortunate a few years ago to be the recipient of a grant that helped us set up a unique program called the PCLT, which stands for the Primary Care Leadership Track. The Leadership Track is for students who are entering medical school to declare at the beginning that they want to be in primary care. We've seen a great evolution in the interest in that through this program. It's different in that it's a longitudinal program. In the second year, when they do their clerkships, they get to spend time with a designated family doctor and other primary care providers on a regular basis for a set period of time. Then in their third year, we get them involved, and even in their second year, we get them involved in a program I'm sure you've heard about, or will, called PHIL, which is the Leadership Program for Population Health. And then in their third year, they get to work with the residents in the process of developing projects and working with the community. That has been the best thing we've found so far as with regard to getting students involved. The other thing that I am seeing, though, and I've been doing this for about 15 or 20 years, is that I'm actually starting to see some of the students who are coming in with a desire to do community things and a desire to be involved in the world showing more interest as well. So I think that as time goes by and as the health center changes, we're going to see even more. But the number one thing that I've seen in our program that works is getting them involved with our residents. They're the real role models that these students get to see. And if anybody's going to influence them, that's who's going to be doing it.
So I came to Duke Family Medicine to be trained as an outpatient specialist, as a family medicine doctor. I wanted to learn how to treat individuals as well as communities in a population-based sense. And in that sense, Duke Family Medicine has met those goals for me.
So I came to Duke. I have a passion for lifestyle medicine, in particular preventive medicine, and promoting health and wellness, not only in myself but in my community at large. Duke Family Medicine has long been a symbol of excellence and innovation, and I'm here doing my training in order to give me the skill set to do the things I'd like to do in the future.
Coming out of med school in Chicago, I was actually looking at the entire country, and I could have gone to the West Coast, stayed in the area, or come to a place like Duke. And I chose Duke because not only was it going to train me in a very strong family medicine program, but it would do much more. It would open my horizon to the community at large, to learn new skills in population management, and things that I couldn't even dream of. This is a program that's always changing and learning from different programs all over the world as well, and I just want to be on the cutting edge of that.
What we've been doing at Duke for 20 years now is linking the family medicine residency with our community and our public health department and our community organizations to identify folks for whom we can prevent chronic disease and to intervene early. We've been able to reduce hospitalization rates for kids with asthma by 70%, and our partners have now, in other parts of the country, reached 80%.
It's about passion. It's about becoming the best family doctors we can be. It's about taking care of our communities and decreasing healthcare disparities.